Welcome to the webinar, Online Training for Your Healthcare Staff. I'm Jan Chambers, the Business Operations Manager for HealthPOINT at Dakota State University. Today we're going to give you an overview of the online health IT training programs that we offer. I've muted all of your lines, so if you have a question, please type that into the chat box, and I will try to answer that at the end of the session. Depending on the number of questions, we should be done in about 20 minutes. Before we start the webinar, I want to remind you of an upcoming webinar we have on May 23rd, the importance of disaster recovery, backup of your data. We will also touch on image backup and hosting during the course of this webinar. Be sure to tell your IT person or the decision maker of your organization about this webinar. This is a key component of your system, especially as we begin the season of flooding and tornadoes. You can register on the link shown on your screen currently or at the HealthPOINT website also on your screen. As you can see on the screen, HealthPOINT offers 6 IT training programs. We will touch on each of them today. We will cover topics of each, the skills and competencies gained through each, the costs, as well as continuing education credits available. I will also share some special offers and discounts that we have available on some of these programs. All of the training programs we will discuss today can be found on the HealthPOINT website. The website address is healthpoint.dsu.edu. Then go to the Services tab, as you can see that's in the middle of the screen, and scroll down to the Health IT Training. You will find information as well as the registration form. Again, that address is healthpoint.dsu.edu. As we go through the information today, please let me know at the end of the webinar if you need me to go back to any slides, as I'm going to try to go through these fairly quickly. Again, these are all open-end registration. You can apply at any time. It's 100% online delivery. All you need is the internet. It's self-paced, and there are no textbooks to purchase. You simply need to register online. The first one we're going to talk about that's probably of interest to many of you is the Anatomy and Physiology Review for ICD-10. As you know, ICD-10 takes effect October 1st, 2014. The transition to ICD-10 is required for everyone covered by HIPAA. And for more information on ICD-10 specifics, just visit the cms.gov website. Our Anatomy and Physiology Review for ICD-10 is an easy way to begin preparing for this transition. The review program covers anatomy and physiology, disease processes, and procedure for each body system. There are 11 body systems, which you can see are listed in the right column. You can also view the continuing education's credits for each body system listed there as well. You can take one body system or 2 body systems, or you can take all 11. If you take all 11, you have 6 months to complete all 11. If you take just one, you have to complete it within 1 month. If you take all 11, you can earn up to 23 continuing education credits. As you can see, this lecture is available as traditional PowerPoint slides, as listed in the middle of your screen. Skeletal System Anatomy PPT is a traditional PowerPoint slide, or you can choose to take it as a PowerPoint presentation in video format, which you can see is also listed. There are optional worksheets for each unit and a medical terminology glossary for each body system. You can also see that each body system has a checklist that includes everything available to complete the section. After each unit, you will need to complete the associated quiz. The quiz questions are multiple choice, true, false, and matching. You must earn 70% or better on each quiz to successfully complete the body system review. You have 3 attempts to earn a 70% or better. Once you've earned the 70% or better, you have no more attempts at the quiz. The cost of this program is divided out a couple of ways for you. If you choose all 11 body systems and you're a HealthPOINT member or a South Dakota HEMA member, it's $175. Non-members are $295. Each individual unit, as we talked about earlier, can be taken, and that's $40 for members per unit and $60 per non-member. And if you see at the bottom of the screen, if you register before July 7th, you can receive 20% off of these prices. So it's a great value at that price. The next course that we're going to talk about, excuse me, I went ahead there a little bit, is the Long-Term Care Introduction to Health IT for Managers. To assist long-term health care providers with implementation and adoption, HealthPOINT has developed curriculum to boost your health IT skills and knowledge. This certificate is targeted toward health information management and medical records directors, but is available to anyone looking to increase their health IT knowledge base. This was developed in partnership with the Good Sam Society, and there are 28 units that must be completed in 20 weeks. And you can also see on your screen that there are 20 HEMA continuing education credits that are available. Now let's take a look at the different units. I'm not going to read through all of these because you can see them on your screen, but these are the units and the modules that are covered. The basic headers are the Introduction to Information and Computer Science with 8 modules, Terminology, Clinical Vocabularies, the High-Tech Act, Health Information or Health Management Information Systems with 5 modules. And continuing on of the units covered, there is a Working with HIT Systems that has 6 modules, a Workflow Process Analysis, and an HIT Quality Improvement unit that has 4 modules. The cost of this program is $300 for members and $425 for non-members. Again, we have a great discount here. If you register before June 9th, you receive 20% off of the above mentioned prices. Let's jump into the Introduction to Health IT. This course is designed to increase your understanding of electronic health records and the major factors influencing the implementation and adoption of EHRs. There are 14 units, which must be completed in 3 months. This is a very thorough course. It's a good refresher for anyone, but a great refresher or a great overview for new employees. You can see the units covered on your screen. The meaningful use covers the menu items and core items. Privacy and security is covered in depth, as is the CPOE, change management, just various aspects. Very thorough course. Many of our health IT programs offer options in the format for the course, and this one has several. With this course, you can choose the PowerPoint presentation, which is noted as on your screen with the PPT, or the VoiceOver PPT, which is a voice over the PowerPoint presentation, which offers a little more in-depth than just reading through the slides. There is also an MP3 audio file and the transcript of the presentation. So you choose the way that's best for you. Some units are divided into multiple subunits or modules, as you can see is the case with this one with Component 3, Unit 14, and Unit 16. As shown on this previous screen, there are quizzes to take for the certificate. The quizzes, again, are required to be at least 70% or better and are true-false, matching, or multiple choice. Some of our training programs also require a discussion board posting, and you can see what that looks like on your screen right now. The cost of this program is $50, and it is a great value. It's very thorough, and I would highly recommend this to any new staff that you have coming on board. And this has also got a special offer. Register one employee and receive the second employee if registered by July 7th and at the same time for half off. So 2 employees for $75. It's a great value. Let's talk next about the HIT implementation and support program that we offer. There are 9 classes to be completed in 9 months. Workers in the roles of implementation support specialists and technical support staff provide on-site support for the period of time before and during implementation of HIT systems in clinical and public health settings. These individuals will provide support services above and beyond what is provided by the vendor to be sure the technology functions properly and is configured to meet the needs of the redesigned practice workflow. Those in this role will also provide one-on-one support in a traditional help desk module to individual users with questions or problems. And you can see the topics listed on your screen, covers a variety of different things, including installation and maintenance, usability and human factors, health management information systems. It's a broad spectrum. The skills and competencies that you could expect to gain through this course include execute implementation of project plans, incorporate usability principles, test the software and internet with vendors, assure privacy and security function, assist with execution of audits, diagnose IT problems and implement solutions, and document IT problems and evaluate problem resolution. The cost of this program is $730, and again, it's 9 classes, and they must be completed within 9 months. Let's talk about the HIT management program that we offer. This program addresses the critical components of managing HIT and EHRs in healthcare provider settings. The knowledge and skills learned prepare individuals to take leadership roles during the initial implementation of EHRs, as well as providing leadership for ongoing technical support teams. As you can see on the screen, there are 5 classes, and you have 6 months to complete these classes. The Health IT Quality Improvement, Introduction to Project Management, Planning, Management, and Leadership for Health IT, Working in Teams, and Fundamentals of Health Workflow Process Analysis and Redesign. Competencies and skills gained during the course: provide leadership to implementation teams, learn project and change management skills, interact with diverse groups and ensure open communications, understand vendor relationships, and coordinate implementation efforts. The cost of this program is $400, and again, there are 5 classes to be completed within 6 months. Once the registration forms with all of these classes, once the registration form is processed, a link to the online payment form and the invoice will be emailed to the registration, to the registrant. All right, the next one is the HIT trainer course. Workers in this role design and deliver training programs using adult learning principles to employees in clinical and public health settings. The classes are again listed on your screen. There are 5 classes that must be completed in 6 months. The skills and competencies that you could expect to gain from this course are communicate both health and IT concepts, user-oriented approach to training, assess needs and competencies, design lesson plans, structure learning activities, or active learning, maintain training records as well. The cost of this program is $400. And that covers all of our programs that we offer with just a little bit more information. All of these training programs are offered, again, 100% online through the Desire to Learn network from Dakota State University's website. Once you complete your application and it is accepted, you will be emailed a link to the program along with the password, and then you can see on the left side of your screen where you would enter your username and password to access the system. At this point, I would like to see if anyone has any questions or if there are any slides that you'd like to have me go back and do. And I think what I'm going to do is just unmute the lines for a second, and if you have any questions or slides that you would like me to go back through, please let me know, or you can still type your question into the chat. Does anybody have any questions? Any slides to go back through? If you have any questions later, please feel free to contact me. My email is jan.chambers@dsu.edu. I've also posted Catherine Ingram's information on the screen. She is the head of the program, and her phone number there is listed as well. And I think we will go ahead and end the webinar unless anybody has any questions. And I do not see anything in the chat. So I thank you for your time today. And again, please remember we have another webinar on May 23rd regarding data backup and recovery, as well as some image backup and hosting. Thank you again for your time today.